guys, I'm gonna just go ahead and tell you from the jump, I miss you guys. How you guys been doing? But anyways, welcome back to the channel, guys. So I've been getting so many emails. Patricia, I need help. Patricia, I don't know what I'm doing. Patricia, I don't know how to sell. So anyways, in today's video, I'm going to show you guys how I present someone a Medicare Advantage versus a Medicare Supplement. So basically in this video, I'm going to show you guys how I help my clients decide if they want a Medicare Supplement plan or a Medicare Advantage when they have original Medicare, okay? So that's what I'm going to show you guys today. It's pretty simple. Disclaimer, I'm going to be showing you guys a tool that I did not get no permission to show on the YT. So I am taking this risk because number one, I miss you guys, and number two, it seems like you guys need help, and it seems like you guys are not really getting help from your upline. So I got you, girl. But if I'm asked to take this down, I'm going to take this video down. So you better get notes, take notes, and do what you gotta do, because girl, I'm taking the risk. So anyways, I'm going to show you guys what I show my clients, and in the description of this video, I will show you guys how to get access of this one-page tool that I use from one of my carriers. You can get it as well as long as you are an agent contracted with that carrier. Okay, so anyways, let's get right into the video. Alrighty guys, so first, before I show you guys my one sheet that I use to help my clients decide whether they want a supplement or a Medicare Advantage, first we need to have some understanding before we do this presentation, okay? We need to know what we're talking about, we need to have confidence, and we need to educate ourselves so that way we can educate our clients in a very simple way, okay? So first, I'm going to share my screen and I'm going to show you the difference between original Medicare A and B, the actual cost of original Medicare without a supplement or a Medicare Advantage plan, okay? So let's go ahead and share screens. All right, guys. We are on Medicare.gov. And this is where you want to get all of your updated information every single year. So that way you have the updated information. So that way you can pass on the information to your clients in a very simple way to understand. Of course, we know that Medicare Part A is your hospital insurance and Medicare Part B is your medical insurance, okay? So let's talk about the cost of original Medicare right now. Okay, so for Medicare Part A, here is your cost, and we're going to talk about 2023 costs, okay? It says 2022, but it does have the 2023 updated cost, and I highlighted that so that way you guys can see. So when someone worked in the US for 10 years, 40 quarters, when they turn 65, they are eligible for Part A. And for most people, that would be $0 per month for Part A because they paid into that. They paid Medicare taxes. So it's not really free because they paid into that and their taxes, okay? So Part A is $0, okay? Now with this, there is a deductible. In 2023, is $1,600 for each inpatient hospital benefit period before original Medicare starts to pay. So they get admitted to the hospital, they have a deductible of $1,600, okay? And that's each time they get admitted to the hospital. There is no cap to that, okay? Let's talk about inpatient hospital stays. So for days 1 to 60, they pay $0 after they meet that Part A deductible of $1,600 in 2023. Now for days 61 to 90, they are going to pay $400 per day. Day 91 to 150, right? They're going to pay $800 a day. It says right here, days 91 to 150 copayment each day while you're using your 60-day lifetime reserve days. And after day 150, they are responsible for all costs. Now, this is very important because this will wipe your savings out, okay? If you only have original Medicare, this is the true cost for Medicare Part A if they end up in the hospital, and you don't want that, okay? Very important that you know that, okay? Now, let's talk about if they get admitted into a nursing home after the hospital stay. Say they need rehab to, help repair a fractured hip. So in the nursing home for days 1 to 20 is going to be a $0 copayment. For days 21 to 100, they're going to pay $194.50 each day. I'm sorry, that is 2022. In 2023, they're going to pay $200 per day for days 21 to 100, okay? I highlighted the wrong area, so let me go ahead and see if I can erase that so that way you guys can clearly see that. So let me get my highlighter here. So there we go, $200 for days 21 to 100. You're going to pay $200 every single day for those days. And days 100 and beyond, they're responsible for all costs, okay? So that is very important and very expensive with having only original Medicare. Let's talk about Part B. So Part B is your medical insurance. What will they pay for 2023? Now, Part B does have a monthly premium cost. Most people is going to pay $164.90 in 2023 each month for Part B, okay? It does go based on their income, the last 2 years of their income, but most people will pay the $164.90 each month for Part B in 2023. Now, there is an annual deductible they have to meet before original Medicare will kick in, okay, for Part B. And that annual deductible is $226 in 2023. That is a one-time deductible each year, okay? Now, this is what you really also want to know is that for your general cost for services, usually 20% of the cost for each Medicare covered services or item after you pay your deductible. Basically, Medicare is going to cover 80% and your client is responsible for 20%. There's no cap, okay? There's no limit, there's no cap. I call it the danger of having original Medicare alone. So it's very important that they have a supplement or a Medicare Advantage plan to help cover those costs, okay? All right, guys, so the next thing I'm going to show you guys is a Medicare Supplement chart, okay? What is a Medicare Supplement? It's different from a Medicare Advantage, okay? A Medicare Supplement is the sister of original Medicare. Like we said, original Medicare is going to cover your 80%. The supplement is the sister, and she's going to cover the 20%. With brother and sister, now you have 100% of coverage. That's the way I like to look at it. So now let's look at the sister for original Medicare, okay? Which is the supplement plans. Let's look at the supplement chart. Okay, let me show you guys. All right, guys, so we are looking at our Medicare and U-Book 2023. And we are looking at our Medicare supplements, also known as Medigap. And I like to call it the sister of original Medicare, okay? Like we said, original Medicare is going to cover 80%. Sister is going to cover 20%. Now, the popular plans are Plan G and Plan N, okay? So what are the key differences between Plan G and Plan N? All right, guys. So if you scroll down here, you're going to look at Part B excess charges. So Plan G covers 100% of excess charges and Plan N does not, okay? So Plan G is going to cost a little more than Plan N because Plan G does cover excess charges. So what are excess charges? So Medicare set aside fees for certain services. Now, a doctor can say, I would take your Medicare, but I also charge extra from what Medicare charges, okay? So say a doctor visit for original Medicare is, let's say, $100, but the doctor say, I will take the $100, but I also charge an additional $20. Those are excess charges. Well, Plan G will cover the excess charges and Plan N will not, okay? Another key difference about Plan N is that Plan N pays 100% of Part B coinsurance. You must pay a copayment of up to $20 for some office visits. So Part N is going to have some office visits copays up to $20 for each visit and up to $50 copayment for emergency room visits. So that is the differences between Plan G and Plan N. So Plan N can have some copayments, Plan G no copayments, and Plan G will cover the Part B excess charges. Go ahead and study this chart, okay, before you sit with your clients if you want to sell Medicare supplements. Alrighty, guys, so we looked at the Medicare Part A and B. We looked at the Medicare Supplement plans. Now, another thing that I highly recommend is that if you are serving low-income clients, I highly recommend that you find out in your state if you can help them apply for Medicaid. So what is Medicaid? Medicaid will help them with paying Medicare Part B. I'm in the state of Florida. In the state of Florida, I can do the Medicaid application with my client. I can assist them with the application. I know how to write that application. It takes me about 30 minutes or so. But the key thing about this is if you help them get this Medicaid, right? You help them get Medicaid, which is the Medicare Savings Program. If they get the full level of Medicaid, Medicaid will pay for Part B, right? It will pay for Part B. In 2023, Part B is $164.90. Let me make sure I said that right. Yes, $164.90 for Part B in 2023. So if they have full level Medicaid, actually, if they have Medicaid, period, Medicaid will pay for their Part B. If they have full Medicaid, it will also pay for deductibles, co-payments, and co-insurance. So it's almost like having a supplement plan. If they have both Medicare and Medicaid, their bills are pretty much paid for. And also, if your client can get something called LIS, which is extra help, if their income meets the requirements, help them do the LIS application. The LIS application takes about 10 minutes, and what that does is help them pay for their prescription drugs. If you go the extra mile and do this for your clients, they will love you for life, okay? Do it for them. It will help them in so many ways, especially if they're already on a fixed budget and they are a low-income senior. They could get food stamps, and the Medicaid, if it's available in your area, will help them qualify for other Medicare Advantage plans, such as a dual plan, a D-SNP plan. And what that plan does is give richer benefits, such as richer dental, vision, hearing, transportation, and the healthy food card. They can use that card to pay for their bills, electricity, all kinds of fun things, all kinds of great benefits if it's available in your area. I'm in Florida, and girl, let me tell you, guy, let me tell you, we have some rich benefits for individuals that have both Medicare and Medicaid. And like I said, if I could get my clients the Medicaid, I would definitely do the application for them, and they would love me for it because they get so many extra benefits. And like I said, grocery cards every single month that they could use. They could use the card also to pay for their rent, their light bill, gas, pet services, pest control, and so much other fun stuff and jazz, okay? So that's something is very important for you to know. Let me just show you guys the income requirements for Medicaid. All right, guys, so this is the Medicare Savings Program like we was talking about, which is Medicaid, and these are the Medicaid levels, okay? So QMB is your full level of Medicaid. Like we said, it helps pay for Part B. Like we said, it pays for Part B. It pays the deductibles, co-insurance, and co-payments. This is the income requirement. They can't make more than $1,153 as a single person. And it also has a resource limit requirement as well. So this is the resource limit. It does not include their home and one car. Okay, so they can have a home and a car. That is fine. That is not included in their resources. Okay. Now, the second level of Medicaid is SLMB. With that level, they can't make more than $1,379 per month. And with that, they would get their Part B paid for. And some of these D-SNP plans will allow someone with SLMB level to get that food card and such. It depends on your area, okay? But definitely the full Medicaid, definitely a yes, especially in Florida. Now with QI, this level, they can't make more than $1,549. Now they may not get all these extra benefits, but Medicaid will pay for their Part B premium. So that is still great to know, okay? So that is the Medicare Savings Program. Now we're going to talk about that one-page sheet, and I'm going to share with you how I break it down in my appointments. Now, I do want to make this clear. This one-page sheet is not the end-all, be-all. Once they decide if they want a Medicare Supplement or a Medicare Advantage, then I go ahead and present their options, okay? So if they want a Medicare Supplement, then of course I help them find a drug plan, and then we go ahead and do the quote, and then we go ahead and do the Medicare Supplement application. Pretty simple process there. Now, if they want a Medicare Advantage plan, then of course I look for their medications to see what plan is best as far as their drugs, to see what doctor network they want to be in, HMO or PPO, make sure they doctor take the plan, see what's their hospital preference and things like that, pharmacy preference, you know, and then I go over the 5-star rating of the plan, summary of benefits, and, you know, do a really good presentation with the Medicare Advantage plans. So anyways, this is my one sheet that I use so that way they can decide if they want a Medicare Supplement or a Medicare Advantage. I make it pretty simple for them to understand. Alrighty guys, so we have come to the part of the video that you wanted to watch, okay? So here is my one sheet process when I'm talking to my clients. So they come into the office. Of course, I ask them if they want any water. I do small talk and I ask them little questions about themselves, make them feel very comfortable and all of that jazz. I let them know that it does not matter if they choose a Medicare Supplement or a Medicare Advantage plan. It does not matter to me at all. My goal is to help them choose what they feel is best for them. All right, let's get with the quick presentation, okay? So I let them know. I said, Mr. John, let's say it's the guy, right? So I say, Mr. John, so you have original Medicare. So you have Part A and you have Part B. Let me get my little pen here. So with original Medicare for Part A, you are not going to pay a premium for Part A. Part A is free. You paid that already when you paid your Medicare taxes when you was working, okay? Now in 2023, Part B is going to be $164.90, okay? If you are drawing Social Security, that's going to come out of your Social Security check, or you could pay that every quarter. They'll send you a bill, you pay it every quarter. If not, you can have that taken out of your Social Security check every single month. They will take that out, okay? If you choose that option to pay for your Part B. Okay, so this is original Medicare. Now, there is a danger with only having original Medicare alone, okay? So, Mr. James, I think I said Mr. James, right? Mr. James, original Medicare will help you cover 80% of your bill. Now, with original Medicare, there are deductibles for Part A and deductibles for Part B as well. If you get admitted to the hospital, your deductible would be $1,600 before Medicare kicked in, okay? And if you want to go ahead and show them that little chart of how that go right ahead and show them how much it is for each day in the hospital. Now remember, Medicare is going to cover only 80%. You are responsible for 20%. That 20%, there is no cap. Like, there is no nest egg, okay? So that 20% can wipe out your retirement. It's the truth. It can, right? So these are your two options, okay? You have a supplement plan and you have a Medicare Advantage plan. First, let's talk about the supplement, okay? The supplement is basically the sister of original Medicare. These two work together. So the supplement is going to help cover that 20% that original Medicare leaves behind, give you 100% of coverage. Now, that deductible, now there is an annual deductible every single year, which is $226. Once you meet that annual deductible, then your Medicare supplement will kick in and pay the rest, okay? Now, for a Medicare supplement, the popular plans are Plan G and Plan N. With a Plan G, male turning 65, it's about $205 per month. Or you could go with a Plan N, and the Plan N is going to be about $170 per month. You also need a drug plan as well. Depending on the medications that you take, it could be about $15 per month or more. Like I said, we would have to research your medications to see which medication Part D drug plan will work for you, okay? So we're looking at about $390 per month for a supplement. Now, I would like to say the supplement is like the Cadillac, okay? The supplement is a great option because you don't have to worry about co-pays or anything like that if you go with the Plan G. Now, with the Plan N, there are some co-pays. For the doctor visit, it could be up to $20. For ER, it could be up to $50, okay? So with a Medicare supplement plan, it basically covers you at 100%, okay? It works hand in hand together. You have your monthly premium. A lot of clients love these supplements because they can travel with the supplements, okay? And also with a supplement, you don't have to worry about doctor networks. If your doctor takes original Medicare and are accepting new clients, you can go see that doctor. You don't have to worry about if they are a network or not because there is no network.
And like I said, you can travel with this plan as well. All right, so I want you to think about the supplement for a few seconds. And as they're thinking about it, I'm just talking to them, making small talk and such. Okay, and we may talk about it or whatever. You may have questions and all of that.
And don't forget to mention with a Medicare supplement plan at the age of 65, when they're first eligible for the supplements, okay? Either at the age of 65 or when they first become eligible, say they are deciding to not have Part B at the time. They delay Part B because, say, they have insurance through their employer. When they become eligible to enroll in Part B, they do not have to worry about answering any health questions. So at this age is the best time to enroll in a Medicare supplement, because later on, if they decide they want to be on the Medicare supplement, they will have to answer health questions. And at that point, the Medicare supplement can deny their application. Okay? Very important to point that out so that way they know.
Now we're going to talk about option 2, which is your Medicare Advantage plan. Now, with the Medicare Advantage plan, it's not the sister of original Medicare. The Medicare Advantage plans replaces original Medicare. So what that means is that the Medicare Advantage plan takes on your medical risk. So original Medicare pays Medicare Advantage companies to take on your risk.
And when I do explain the Medicare Advantage plan, I do point out this is what you see on the commercials, and this is what you see highly advertised on, TV and just everywhere. Like, everyone is advertising Medicare Advantage plan, and it just kind of makes them be like, oh, okay, this is what they're talking about. This is what they're talking about when they're talking about the extra benefits such as dental, vision, hearing. Drug plans are included. This is Part C. So I do point that out, and it kind of make them be like, oh, okay, I understand.
And these Medicare Advantage plans are private insurance companies that follows original Medicare rules, and you may need pre-authorization for certain medical things that you may need. So with the Medicare Advantage plans, here in Florida, the plans are pretty rich and they're usually $0 per month, okay? With the Medicare Advantage plan, it's also going to include prescription drug coverage and extra benefits such as dental, vision, hearing, transportation, over-the-counter products, and such. Now, like I said, the monthly premium is $0 per month, but you're going to pay copays, okay? So with the Medicare Advantage plan, you pay as you go. So depending on the plan, your copays can go like this, and I'm just giving you some examples, okay? So I'm going to just go ahead and give you some examples of some copayments. It depends on the actual plan. So the primary doctor can be $0. Your specialist doctor could be $20. Labs can be $0. X-rays could be $50. The ER visit can be $90. You get what I'm saying? You pay as you go. When you use the plan, there is a copay, okay? So that's how the Medicare Advantage plan works, okay? So like I said, the Medicare Advantage plan will include your prescription drug coverage. And of course, we have to look at your drugs to see what plan will best fit the cost of your medications. And like I said, it comes with extra benefits such as dental, vision, and hearing, okay? Now, with the option 2, the Medicare Advantage plan, there are two main different type of plan. One is called a HMO, and the other one is called a PPO. And these are provider networks, and I will explain how these two work. So with the HMO, most likely you would get richer benefits, but you have to stay within doctor networks, okay? So you can't just go in and out of network. Now, if you do decide to see a doctor outside of that HMO network, you will pay for that doctor visit, okay? The Medicare Advantage plan would not pay for that visit, okay? So like I said, if you have an HMO plan, you have to stay with the network. If you need to see a specialist, then your primary physician will send a referral so that way you can see a specialist, okay? So you have to have referrals. You have to stay within doctor networks. Like I said, you do get richer benefits. Now, with the PPO, you can see doctors outside of that PPO, okay? It may be an extra charge if you go outside of that network, but you can see doctors outside of the network. So you have a broader option when it comes to doctors. Now, the extra benefits won't be as rich as the HMO, but you have that benefit of seeing doctors outside of the network. That is the great thing about the PPO. You do have more options when it comes to doctors, okay? So that's the PPO plan versus the HMO plan. So the key thing that I want you to understand about the HMO is that you have to stay within doctor networks. If you need to see a specialist, you need a referral from your primary physician, and the HMO is going to give you richer benefits. And also, certain things you need to get done, you do need authorization from the Medicare Advantage plan. With the PPO, you're going to get less benefits, but you have more options when it comes to selecting doctors, and you do not need a referral to see a specialist. So that is the key difference between an HMO and a PPO.
Now, I don't want to make this video complicated, but I do want you guys to take note of this. Some Medicare Advantage plan companies will have certain HMO plans where they can have that HMO plan and do not need a referral, okay? So it just depends on the Medicare Advantage plan itself, but the general rule is if you have a HMO plan, you're going to need a referral. And it's so funny because some doctors are so old school and they're so used to doing things a certain way. Even though you may have an HMO, they still may want to send a referral because they're so used to a HMO, you need a referral. So just keep that in mind. Some plans may not require a HMO, so it just depends. But like I said, a general rule with an HMO, you do need a referral.
Alrighty guys, so after that presentation, then I will ask them if they have any questions, and I will ask them what route do they want to go. Do they want to go with a supplement or a Medicare Advantage plan? And from there, I will go on to the next step, okay? So if they want to go with the supplement, then we go ahead and do the quote and we do the supplement application. If they want to go with the Medicare Advantage route, then of course I go through that. And that's pretty much it. So I go over the 5-star rating, the summary of benefits, go over their meds, and all of that jazz that we all have to do. But that is pretty much how I make Medicare pretty simple to understand.
Alrighty guys, I hope you guys enjoyed this video as much as I enjoyed making it. Comment below because I miss you guys. Like, how you guys doing? Let me know in the comments. And of course, I will respond to you if you have any questions, concerns, all of that. So let me know in the comments. And if you're not subscribed, I need to know why. Come on, why you're not subscribed? Anyways, I'll see you guys on the next video. Bye guys, ciao for now. Alrighty, so you could go ahead and check out one of these videos and I'll see you on the next one. And as always, take care and God bless. Bye guys.